Welcome to the Module 11 review for exam number 3. Okay, instead of putting in specific slides, you have many of the slides starred. I did put in a few specific slides, but I thought I'd go over some of the important points. So, these are some questions and things that you need to know. What may happen if you give an antidepressant to a patient with bipolar disorder? You need to investigate the answer to that. Know first line and second line treatment drug classes. Know what other uses for antidepressants are, and know the indications of particular drugs that are in your lecture. Know which drugs or drug classes have greater sexual adverse effects and which do not. Know the drug interactions discussed in the lecture. Know the contraindications for the different drugs and drug classes. And for 2 questions, you'll need to know the dosages for fluoxetine and citalopram. So that's pretty specific on that one. This is the list of SSRIs from the most to the least energizing. So you do need to know this. And then many of the items that are underneath each of those medications. And you need to know the indications for particular ones. So this is the, which ones for cardiovascular disease, which ones are best for adolescents. You do need to know those specifically. And which ones to use, avoid or use in caution with. And again, this is more about the drug interactions, so which drugs are more likely to have drug interactions and which are less likely. And then adverse effects. They're pretty, some are pretty common to all, some are not. The sexual dysfunction is in here. Notice the QT prolongation. Weight gain, that's another big one. Here's the slide from SNRIs. I don't ask a lot about this, but again, the sexual adverse effects is about 40%, and they need to be titrated down. You cannot stop these cold turkey. Look at the atypical antidepressants, especially mirtazapine, which is Remeron. And when should you switch drugs because of a suboptimal response? So we kind of talk about a no response, a partial response, and then a complete response. So it's highlighted in red. And this was that slide that you have. So this is the group in the first one that's circled in red of the ones that can be used first line. And then if there's a partial response, what you can augment those drugs with. Remember, you can't give 2 SSRIs together, so it has to be a drug from a different class with a different action. Now, benzodiazepines. Know that they need to be withdrawn gradually. It takes just a short time to become dependent on these. And know the symptoms of withdrawal. Know the contraindications and precautions for it, and then when to use short-acting, medium-acting, and long-acting benzodiazepines, and which ones are more likely to cause withdrawal, rebound, and dependence. And then how quickly do they work? I just mentioned this briefly. They act within minutes to hours, so it's not a delayed reaction. And then for bipolar disorder, you do need to know the difference between bipolar 1 and bipolar 2 from above and below, so meaning mania and depression, and which drugs can be used for both manic and depressive episodes. You need to know the drug classes of treatments for each, for bipolar 1 and bipolar 2 manic and depressive episodes. Know lithium well. I left the next couple of lithium slides in here. And be familiar with valproic acid and lamotrigine. And then review second generation antipsychotic slide, which is just one slide, and they're also called atypical psychotics. I think the question in the test uses atypical psychotics. So this is lithium. They don't really know how it works. It is good for mania and mixed episodes, which means they have mania and depression, and can be used for then acute management and maintenance. And for this part, again, you can look at the therapeutic effect. The mania works relatively quickly, but improving depression takes many weeks. But look at the side effects. Look at which ones are transient and which ones are long-term. And then this is the only slide you have on the second generation antipsychotic drugs. I do need to make a lecture on antipsychotics and just haven't gotten to that one yet. But this slide has the information you need for the questions. Now for sedative and hypnotics, know when to use which drug and drug classes. What are the indications for each? Know which are used for sleep onset versus sleep maintenance. That's very important. And then know the side effects of commonly used non-benzodiazepines, the Z drugs. And then for anxiety treatment, which SSRIs are good for anxiety, which SNRIs, and what would you use for anxiety if the person has an addiction problem or a dependence problem. And then know the different treatments for or between acute and chronic anxiety. One more, when to use benzodiazepines. They're mainly used for acute episodes, and they're not indicated for most anxiety disorders. Okay, for headaches, you need to know which medications are used for prophylaxis and abortive therapy for migraines, cluster headaches, and tension type headaches. So in some of the questions, you'll need to be able to identify the symptoms of each type of headache to determine the treatment. And then specifically, know the routes of sumatriptan and their benefits. Okay, for pain, there aren't that many questions on the pain medications. All the test questions come from the CDC presentation that's in your presentations, and that one's called Applying the CDC's Guideline for Prescribing Opioids. So there are questions within the presentations. I would review those. Then I would focus on when they say to use immediate versus extended release pain medications, obviously opioids, the risk and benefits for using opioids, the indications for using opioids, and then become familiar with the PDMP, which is the Prescription Drug Monitoring Program, and how and when and why to access it. Okay, on to Module 12.